Good morning, everyone. Hopefully you can hear me. And I'll start off by wishing everyone a happy snow day. It's always an amazing adventure when we get snow in Tucson all the way down in the valley. And so if you were up late last night, you saw the snow start coming in, or maybe you woke up this morning and we're just amazed. But we have a robust program for you today. And so I want to go ahead and jump in as soon as possible. We have a number of presenters who want to share some valuable health information with you. So this will be today's March 2nd school health update from Pima County Health Department. And thank you to all of our wonderful collaborators for joining us on this call. We'll start with just an overview of our agenda for this morning. We will begin with some brief announcements. We'll have an update from one of our PCHD nurse supervisors on immunizations. A member of our EPI team will talk about respiratory diseases, including COVID-19, flu, and RSV. We also have an update for you from our chef's team, as well as our EPI team on norovirus here in Pima County. And then as usual, we'll end with a Q&A and ask an epidemiologist. We'll begin with our standard announcements. Just a reminder, if you're looking for Narcan for opioid overdose prevention in your schools, we can help you get linked to this resource. If you're interested, all you have to do is email school support at pima.gov. We also have presentations about fentanyl for staff, youth, and families. We also have COVID test kits available. And so if you are interested in having these at your site, there is a link there in the third bullet point to request them. Just a reminder that some of these COVID tests expired in February 2023. So you'll just want to check the expiration date on any COVID kits that you have on site. If those are expired, you'll want to dispose of those, and we can certainly assist with getting you more. And these are available to pick up at our warehouse. As usual, you can also schedule an on-site COVID-19 vaccination clinic at your school for staff and students for this spring. Our vaccine equity program would be very happy to support you with this initiative and to organize a COVID-19 vaccination clinic. All you have to do is email vaccine equity scheduling at pima.gov. Again, vaccine equity scheduling at pima.gov. We're also working hard and diligently to support the behavioral health and mental health of our students and staff in K through 12 school settings. And so we do have presentations focused on emotional wellness. Some of these topics include practicing mindfulness, managing stress, trauma-informed care, PACS tools, and Text Talk Act. As we move into the digital age, you may remember the last presentation I gave, I invited all of you to take out your smartphones and open your camera app. This fancy graphic here called a QR code will be recognized by your camera app and will present a link, and that will take you to the form for you to sign up, or in the very least review all of these offerings and descriptions. There are presentations that are just for students and presentations just for staff, and so hopefully we have something to offer you that your sites could benefit from. All right, so at this time, I would like to invite our next presenter, Monique Garcia, nurse supervisor at our East Clinic, to talk to us about some vaccine updates and immunizations that will be important to your sites and student communities.
Hi, so a couple quick updates. Again, my name is Monique. I'm one of the nurses at East Clinic. So a big update is the CDC has updated their recommendations for when we start routine administrations of the HPV vaccine. So prior to a couple months ago, the recommendation was 11 years of age, and now it is 9 years of age. So we still offer it to all kids regardless of gender and sex, but now it is considered 9 years as the start date. So it's on time until about 15 years of age, and then we move into this critical phase, turning it from a 2-dose series into a 3-dose series. But when you start making those immunization referral sheets, just do note that the age recommendation has changed. Next slide. So there's several reasons for this push. Most of it came out of the American Cancer Society And if you want to read up more on why that is and some informational material that you can print and distribute, you can go ahead and click or go to this link, hpvroundtable.org. It has all the information there. A couple of reasons I have cited here, which I'll highlight, is offering at age 9 increases the likelihood of kids getting vaccinated prior to their first HPV exposure. Allows more time of the completion of the series before age 13, which results in a stronger immune response to the HPV vaccine. So in all, it increases the number of vaccinations, which ultimately should prevent the number of cancers related to HPV. Next slide. So some quick reminders. These are some common mistakes we've been seeing on the immunization screening referral form that we've been getting from the kiddos. The biggest one being a discrepancy with DTaP and the age that it's given at. So DTaP is not given after the age of 7. After the age of 7, it is Tdap, T as in tetanus. So when you are highlighting the forms for children, if the kid is over the age of 7, don't highlight the DTaP. So I know I talked to a couple school nurses and they told me that you guys usually use a system that auto populates what vaccines they need. So when you transcribe from that system onto the form, if you do have the time, if you can just make a note, oh, this kid is over the age of 7, and don't highlight that DTaP, because we'll get kids in with parents asking for it, and we'll educate them. Of course, we screen them on our end. We let them know that that's not what we do, but it can be kind of confusing for the parents. And sometimes they end up not needing any vaccines when they come in. I don't answer questions right now, do I, Michael? There's a hand raised.
I think we'll save questions for the end of the presentation, but as usual, if you have questions as we go through, feel free to put them in the chat, and all of our presenters will stay on until the end, and we'll be able to funnel those to the correct presenter to answer.
Okay, cool. And another reminder, this hasn't happened too much, just a couple times with bigger families, is just to label these forms with the student's name and date of birth. We'll get families of like 2 or 3 students come in and they'll be like, oh, we need shots for our kiddos. Here are all the shot records and here are these letters, but we don't know who needs what. And the parents can get a little confused or frazzled. So then we'll end up, well, of course, we still screen on our end. Oh. Thank you. And then that was one of our other nurses from the East Clinic. And then yeah, so just for consistency and to avoid more like confusion on the parents' end, if we could just do it or have the forms labeled. Awesome. So helpful tips. We do have okay, thank you. So we do have these forms on the right side, the one that has the Pima County logo. We give them to kiddos if we end up not giving them a vaccine that you guys have highlighted to have the kid get. And so if there's a discrepancy there where you're like, oh, I really think they did need this Tdap or this Hep B, but they got this letter, please feel free to call us to clarify. We might have made a mistake, of course, but it would be it simplifies the process if you call us first instead of sending the parent to us again, and they act as a middleman because it can get confusing for the parent. And at the bottom of the form, it has each of the clinic locations along with the phone number. So we'll highlight where they got their shots. So you can just give us a call, let us know. We can talk about it. Just because I've also, again, seen this with a couple of DTaP kids where they're over the age of 7. So usually the 11-year-old routine shots, we'll give them Tdap instead. We'll write on the form, they didn't get DTaP, they got Tdap because of their age. And then we've had a couple parents get sent back to us saying that they got the wrong shot for the school because the DTaP was highlighted, not the Tdap, and then it confuses the parents a little bit again. So we just want to make it really clear and streamlined. So yeah, please feel free to contact us if you get one of those letters and you're like, I don't think this is right. Definitely call us. So the last thing is, if we can highlight, or if you guys can, to highlight the recommended vaccines as well as the school-required vaccines. You hit the next slide, Michael. Yeah, you guys have a lot of influence over what parents are open to giving their kids for vaccines. So most of the time they'll come in with just the school-required vaccines highlighted. And so the parents will get those. But at the clinic, we do recommend everything they're eligible for, so including the recommended vaccines. But when they come out with the form, they've already primed their kids and themselves for maybe just 2 shots from the required section. And so when we offer them additional vaccines that are recommended per the CDC, they are less open to it. Usually kids are like, yeah, you only promised me 2 shots, mom. I don't want more than that. And the parents are and guardians are maybe a little more hesitant to push more. They'll say they'll come back. Maybe they do, maybe they don't. But to increase the likelihood of no shots missed, it is helpful to highlight the recommended vaccines as well, just to open up discussion and increase likelihood of them getting all of the available CDC recommended shots. Cool. That's it for me.
Thank you so much, Monique. And now we'll bring on a member of our FB team, Matt, if you're on the call.
Good morning, Michael. Good morning, everybody. Yeah, so I'll quickly go through the respiratory update. We're fortunate that we're not in the same trends and patterns we were seeing a couple of months ago with flu and RSV especially, but currently with our COVID-19 community level, we are in low, so that's good news. We've been in low for quite a while now, so that's always good news to see. But with that, we are in that substantial rate of transmission. What we're seeing that our healthcare facilities really look at, that's been bouncing around, between high, substantial for the last few weeks, and ultimately that will change the recommendation for our healthcare facilities, more particularly our long-term care facilities like skilled nursing facilities, to use source control, so masking and things like that. So unfortunately, we're still bouncing around quite a bit. But we're actually seeing about 58 cases per 100,000. We decreased slightly from the previous week, and our test positivity went up about 6%, so we're about 14% currently. And per the CDC COVID data tracker, about right under 23% of those 5 and older have received their updated bivalent booster. And again, this data will be updated later today from the CDC. Next slide, please. And again, here's just a nice little graph to show you. An image here, you can see Arizona right there. We have 1 county that's not green, but overall we're doing pretty well. And as you can see, about 78% of all those communities in the U.S. are at that low level. So that's good news. Next slide, please. Again, just highlighting here how that's calculated and just providing some better insights to our case rates, and then our admissions for COVID-19 hospitalizations are about 5.3 new admissions per 100,000 people. And right under 2% of staffed inpatient beds are used by those that have COVID-19. Next slide, please. And then again, just highlighting this transmission here, quite a bit of different color scheme. And again, as you focus on Arizona, you'll see there's a lot of red and a few orange and some yellow in there. But again, we've been bouncing around between high and substantial quite a bit. I know the slide said substantial earlier, but we are in the high level. So next slide, please. Switching gears to flu or influenza now. Again, our year-to-date total, so starting back in October, we're right over 3,200 confirmed cases, which is about 2 times higher than what we've seen over the last 5 years. Actually, let's see this. We're actually at a different MMWR rate, so sorry, that's my apologies there on that MMWR rate, but we are doing quite a bit better. As you can see at the epi curve, we were actually a lot lower for this completed week than what we would typically see, and we've been decreasing each week as well. So it makes it good news. So there's not really much to say that we're decreasing, but activity could continue to pick up because we are still seeing around 70% of our cases be type A. And we typically will see the second half of flu season switch to type B. So we haven't quite seen that, but again, this season has been very atypical. Next slide, please. Just switching gears here to RSV, very similarly, we have about 1,400 cases, which is still about 3.7 times higher than what we've seen over the last 5 years. And our RSV numbers are still lower than what we've seen over the last 5 years, but it's not as dramatic as what we've seen with flu. So we're still seeing an elevated level, and not over the typical, but still higher levels of RSV. And as you can see, we have decreased a little bit from week 6 to 7. So those last 2 completed weeks, about 20%. Next slide, please. Just a reminder, we always want to make sure that we provide good information to our partners at our schools about disease reporting. So again, we'll keep including this about what's required to be reported and provide those the links so that if you have more questions about what needs to be reported, when do you need to report it, how do you report it, all the fun questions, then we can definitely, it'll be included on this. Next slide, please. And then again, whenever we've included this on here, I've shared this with my team as well a couple months ago, and a lot of our team likes to utilize this app. In addition to, there's another app that the state has that's more geared towards medical professionals, but this is a really great app. So again, I encourage all of our partners on this call to have this app on their phones. Next slide, please. And again, just reminders, you can email us if you have any quick questions or if you need some resources at FEMA.gov, or you can call us at the 724-7797 number. And that number works 24/7. It'll be answered by somebody between 8 and 5. And then if it's after hours, it will go to our after hours service call and they will triage it. But if there is something that needs addressed right away, they will get you through to somebody that can answer your questions. And again, you can always fax us a CDR or any secure information that you need to. Next slide, please.
All right, Matt, I think that's it for disease reporting and respiratory infections. And so thank you so much for being on the call. I believe next on my list is Gretchen. Gretchen, are you on the call?
Hey, yeah, I can go ahead and start presenting, apologies for the not having a good picture on here right now. So I am an enterics epidemiologist with the Epi department, and I'm going to be presenting a little bit on norovirus today. I know a lot of you probably heard in the news lately, just a lot of increased activity or increased awareness of what's currently going on right now, because norovirus is not reportable by providers. We don't necessarily have super current and up-to-date data at the moment of exactly how many cases we have, but it is reportable to health departments and the state whenever there's an outbreak. So that's the main thing I'm focusing on today. So a lot of you probably heard, but it's a very contagious virus. It causes vomiting and diarrhea, often nausea, abdominal cramps, sometimes a low-grade fever. And it's spread through, as you can see in the graphic, so fecal oral contamination, which could be through touching a surface that's contaminated, shaking hands or having contact with a person who has the virus particles on them, possibly even if someone vomits, you can particles of that if you inhale as well. So a lot of common ways we see through folks who change diapers or provide care to folks who are ill, close contact, which is why we're focusing on crowded facilities. So daycares, schools, colleges, long-term care facilities, healthcare facilities, all of those are more common areas where we see outbreaks. And contaminated food and water. So if someone prepares food or food has been contaminated in the field, things like salads, fresh fruits, veggies, we can see folks often get ill from that, and then that can spread. Some other common sources I'll go over the next slide. All right, perfect. So like I said, a lot of long-term care facilities, schools and daycares, congregate living facilities. You hear a lot about cruises, but they only make up a very small percentage of total norovirus outbreaks in the country that we see. And like I said, the food aspect of transmission, so catered events, potlucks, those can be ways that that can also spread. Folks consuming those foods. And like I said, a lot of fresh fruits and veggies, so leafy greens, possibly not getting washed quite as well as they need to be. We'll see it get spread through ice. Some folks will get it through shellfish. Those are some common things we ask about. And I included a graphic from the CDC in the middle there, looking at exposure settings and proportion of outbreaks they represent. So a lot of healthcare, as well as some food facilities, food serving, schools and daycares. And then just to go over some kind of trends we see lately, I included a graphic from our data over the last 5 years or so. And this was from, I believe, December. So it's not quite updated with 2023 data yet, but we looked at for the past 5 years, as of the end of 2022, we generally see a spike more in the spring, late spring, as temperatures start to get higher. Folks having all those outdoor potlucks or food just having that higher temperature to really have that viral particles take off and all of that, and folks being more active and together and outside. All right, next slide, please. All right, so where you guys come in. So we know that, like I said, outbreaks are required to reportable. And so if we, first step is that we would love to hear, just like Matt went over for respiratory outbreaks, any increase in cases of nausea, vomiting, diarrhea, any gastrointestinal illness symptoms. If you get noticed an uptick, especially in a shared space or activity where folks from different households are gathered, and then you see cases, we would love if you would let us know at EPI, that's epi@pima.gov, or that phone number Matt mentioned as well, 520-724-7797, and we'll get back to you on that, just so we can also kind of keep track and offer you resources. This is some of the information and things we'll collect. We often try to get stool samples collected if folks haven't been to their provider and been tested. We try to have any ill staff or students be excluded for at least 2 days following their symptom resolution, just to make sure that there's no further spread. And for food handlers, that's higher to 72 hours. And I know chefs is going to go over a lot of the cleaning procedures. We recommend 20 to 30 seconds of monitored hand washing, specifically for norovirus, to make sure there's getting all of that off of there, and wearing PPE and just being really careful. We have some protocol we can share as well if there are vomit or fecal accidents. And I believe that is all I have for you. I'll turn it over to chefs.
Thank you so much, Gretchen. And Anna, if you're on the call, you're up next.
Yes, hi, good morning. My name is Anna. I work in Consumer Health and Food Safety Division. And then I just realized that we have similar slides, and Gretchen reviewed this, so we can move on to the next slide. And the next one, please. And then, yeah, the next one.
All right.
Sorry, guys. So yeah, in regards to norovirus, we want to implement some control measures. So we want to enforce that frequent hand washing among the kids, staff, employees. For any staff that are reporting to be ill, they have to stay at home for at least 48 hours if they are experiencing that vomiting or diarrhea. And then for food employees, so if you have any employees that work in the cafeteria or kitchen, they have to be excluded for at least 72 hours. And then we want to restrict visitors until the outbreak is over. So we do have like these notices that you guys can place up in the entrances of your facility. If you are allowing visitors to come, we would recommend to provide those norovirus information sheets so they can take precaution and take measures so that way they can prevent from getting the norovirus. Next slide, please. Okay, so when it comes to cleaning vomit or diarrhea, and like Gretchen mentioned, when someone vomits in an area, it's gonna aerosolize and it's gonna contaminate those nearby surfaces. So it's very important that we act immediately. So you wanna review the disinfectants you have within your facility. So not all disinfectants will work to disinfect the norovirus on those surfaces. So I recommend reading your label so you have on your chemicals. We do have this QR code on this slide, and that will direct you to a list of approved agents that are effective against norovirus. So before you even apply that disinfectant on the surface, you want to make sure that you remove as much of the vomit or fecal matter, use disposable towels, and anything that in the process that you use, you'll have to discard it. So that includes like mop heads as well. So you want to make sure that when you guys apply the disinfectant on that surface, that you leave it depending on the contact time of that chemical. So the contact time is going to vary. So for this one that I have right here, this has a contact time of 30 seconds. So when I mean by contact time, you have to make sure that that disinfectant remains wet during that duration in order to disactivate the virus. Next slide, please.
Hey, Anna, really quick.
Yes.
I'm seeing in the chat that the QR code is inactive. It's showing access denied, which is probably based on the EPA website. So if you happen to have a direct link, either you or Gretchen, and could throw that in the chat, I think that would be helpful to some folks who are trying to access that.
Okay, yes, I can add it later on.
Technology is such a gift. All right, next slide.
All right. And then just a couple more items. So if a vomit or diarrhea incident is to occur in a food preparation area, we want to make sure we do a deep cleaning. We want to do like a partial or complete closure until all the cleaning and disinfectant is completed. And if there was any open food or exposed single-use articles, we recommend you guys discard that. And then also, if there's any kitchen linens, make sure you guys keep that separate from linens that are used to actually like wipe down surfaces in like other parts of the school areas. You want to keep that separate because another way that norovirus can spread is through contaminated food or water. Next slide, please. And then here I had the resources. So I'm going to try to see if I can add that web link onto the chat and see if that will work. And
Perfect.
yeah, I believe that's it.
Awesome. Thank you so much. And so we're coming to the conclusion of the call. We really jam-packed a lot of information into 30 minutes. And so I'll go ahead and just conclude here today. Just a reminder that the next schools call will occur next week, Thursday, March 16th at 9 a.m. For those of y'all who are maybe joining us for the first time or need a reminder, we have moved to a bi-weekly schedule, meeting on the first and third Thursdays of each month. However, we want to make sure that we are accessible to you, and you can reach the Pima County Health Department school support through email, so schoolsupport@pima.gov, or you can call our school support line at 520-724-7018. Both of these methods of communication are specifically designed to create a more direct link between our nurses, counselors, social workers, health assistants, administrators who need more immediate support. And of course, as mentioned, you can reach out to our EPI team at epi@pima.gov, especially if you have concerns about disease reporting. Either of these emails will get you to the right place, and we'll make sure you get best served. Just some resources throughout the presentation. So I'm keeping the information here on Mpox, and so this is not a concern, an ongoing concern in our community at this time, but because this was a relevant topic a few months ago, letting that linger on here. And then, of course, if you want to request test kits, there's a link here. We'll make sure this information gets out to you. And as usual, you can visit pima.gov/healthyschools for information, comprehensive health promotion information. There's the school phone number for you, as well as the school support email. And so now I'll move us into our Q&A portion of today's presentation. At this time, if you're thinking that you're going to want to stay on the call, you can until we're done. If you have to leave, that is okay. This is recorded, and I just want to remind that this is posted to the school support YouTube channel, and we'll make sure you have that link too in case you want to watch any of the past recordings. So let me just monitor the chat here. If our presenters are able to stick around with us. Let's see. So we got the link in there for the EPA. Thank you so much for that, Anna. I see that in there. Looks like the 16th is spring break for several schools. I think we'll still go ahead and hold a meeting since these are recorded, and anyone who's able to attend across all of the school districts in Pima County, we'll just get that posted. And so if you're not able to join us, that's perfectly fine. So that's related to your comment, Marlene. Thanks for letting us know that. And then Monique, it looks like you responded to Sandra in terms of immunization records and a contact at ADHS. So thank you for that. Sandra asked a follow-up question, Monique, is there a specific contact we should reach out to when we have questions or discrepancies in immunization records for our students? Sandra says she used to reach out to Brenda Jones at ADHS. Do you have an answer for that?
Oh, yeah, that was the question she had asked previously. So I don't have a contact at ADHS. I wonder if there is someone in the clinic that we contact, but in terms of general immunization questions, like definitely feel free to call us. And a lot of families do have multiple records, so that is something we can consolidate. Like if the school has a set of records that might be different in their immunization blue book and maybe some additional shots they got elsewhere, we can help consolidate that, put it in ACEs. But for other discrepancies outside of the health department, I wouldn't know at this point.
Thank you, Monique. Let me just scan through. Kathy, I see your hand is raised. I don't have the capability to add you on for audio, but if you want to throw your question in the chat, so I'm more than happy to read it out and we can get an answer for you. Sorry about that. Give you a moment to type the question. It looks like Matt Christenberry responded to Laura as far as isolation and precautions for people with COVID-19. Thank you for that, Matt. All right. There's more than one question. Go ahead, hit us, Kathy. We'll do our best to answer them. Excellent. Thank you so much, Crystal, for putting that in there. So the contact, you can contact Crystal about immunization discrepancies. Thanks so much, Crystal, for that resource. Okay, so Kathy, question number one is for Monique. Do your nurses check ACEs when DTaP is recommended, or just say no if they are older than 7?
Yeah, like I said, on our end, we do screen them. So we'll check ACEs, and sometimes they have those forecasted doses at the bottom. But just across the board per the CDC, once they turn the age of 7, there's just no more DTaPs. So if they end up still needing a tetanus containing vaccine, we'll just upgrade it to like the big kid version, which is the Tdap. So T starting with tetanus for 7 and up, and then DTaP for 6 and under. So yeah, once they turn 7, just no more DTaP period. I figure that probably happens as well. What we might start doing, maybe we'll staple that letter to their updated ACEs when we give them shots. We tell them to give it, but of course, I don't know how many hands that letter is transferred to before it even makes it to y'all. But yes, I will remind them to hand that to you guys in addition to their updated shot records. Yeah. DTaP is licensed only until 7, I think. Yeah. And I mean, mistakes happen and it's fine. We'll just educate them on our end. So, but if you happen to remember, catch that when you're transcribing from or onto the highlighted part, just like an additional check. But we always check them when they're here as well.
Excellent. I'm not seeing any further questions on the chat? Kathy, that was 2 questions. If you have more, we have time. We'll stick around if you have any more. Or anyone else on the call. All right. Well, I just want to thank all of our wonderful partners in our schools, as well as the presenters today. I hope that today's presentation was informative, and we want to continue to build this partnership between the Pima County Health Department and our K-12 settings. Thank you for your commitment to ensuring the safety, health, and wellness of our youth communities, as well as our teaching staff. And we hope that you have a wonderful rest of your Thursday, and maybe go outside and throw a few snowballs while they last. Thank you so much and have a great day.